Hi, and welcome back to Lecture 1 for Week 10, Introduction to Community Health. This is part 2 of your lecture. Where we left off was talking about low birth weight in the Tacoma-Pierce County Community Health Status Assessment. So moving on to self-reported health status, we have different categories here: sex, age. The young people didn't report their health, income, education. And as we can see, there's pretty much equal balance of men, women. There was a larger population of this middle age group who reported their health status. In terms of income, there was the low income group was the largest by a pretty huge margin. There was very few people earning $75,000 or more who reported their health status. And in terms of education, the majority of people who reported their health status had some amount of college, but not a full bachelor's degree or beyond. So what they heard about health disparities were that poverty makes being healthy a challenge. There are so many families who cannot afford insurance, healthy food, or to live in a safe community. Access to quality services was also a key finding in this report. Unmet healthcare needs was one of these access issues, and according to this table 10.2, this is the percent of Pierce County adults who did not see a health provider due to costs in the year 2011, which at this point was a long time ago, but it just shows that a large number in Pierce County didn't access health compared to even Washington State. So that was 20%, about 1/5 of adults. Access to healthy food. This is another huge problem in Tacoma. We're just looking here at the percentage who live within half a mile of a store. And there are different types of ways to measure the food access in a neighborhood. There's walkability to a grocery store. There's number of gardens per neighborhood. There's different ways to measure this with kind of proxy variables like that. But this metric was convenience stores versus grocery stores. And it looks like in 2012, it wasn't very much more improved than 2007, where there were only 36% of people living within half mile of a grocery store, and there was 66 within half mile of a convenience store, which you can imagine half mile still takes time. A whole mile is 15 to 20 minutes. A half mile is still maybe almost 10 minutes walk. So sometimes that's all people can do without a car. The percent who live within half a mile of a bus stop. So here's another transportation barrier, is catching the bus. And we're seeing that in 2012, the number has gone down. So it's gone almost from 70% to almost 60% live within half mile of a bus stop. So what did they hear about transportation and access? I live in an older, established rural community with an elderly population. Transportation cuts are making it difficult for people to get around, and neighbors are being forced to choose between medical insurance and food. So this was a really important finding about transportation cuts and how that impacts people's daily life. Protecting and improving the environment was the fifth key finding. So for this finding, we're looking at Puget Sound Clear Air Agency, and they were able to measure number of days over the daily fine particle standard. So PM, particulate matter, is a metric of air quality that measures the concentration of particulates in the air. There's different PM, there's PM10 and there's PM of different sizes of particulate matter. But basically what this graph shows is that the federal standard was changed to 8 days rather than 0. The particulate matter concentration in the air was climbing at an alarming rate and exceeding this level in 2008-2009 to such an extent that it would have been far too much over the 0 days, but only slightly over the 8 days once the standard was changed. In 2010 in Pierce County, we saw an improvement in air quality, and in 2011, again here it's at the new federal standard, which is 8 days, it's back to normal, but had we had the old standard of 0 days, it would have been quite high of 8 days. We've seen in the recent years in this area, in last year and even the year before, and most certainly this year, there's been a lot of particulate matter and smog and difficulty in breathing due to poor air quality from all the smoke and fires. So what residents are talking about in terms of environmental health, one person said that he or she was concerned about poor air quality, specifically the particulates from wood smoke and diesel exhaust. And keep in mind, this was before all of the fire madness that we've had in the last few years. So that's another relationship between, us personally and federal policies in terms of the Forest Service and cutting back the Forest Service, as well as climate change and increasing temperatures and increasing CO2 and how these things impact community health. So some of the questions that they asked were something that I'd like you to think about as well. What surprised you about these data? Why did it surprise you? What about the data strikes you or doesn't make sense or does make sense, given what you know about living in or near Pierce County? So they did some activities, they voted on the issues, but at the end of this assessment, what they found was the following issues, which were health insurance coverage, the ACA, systems coordination and navigation, transportation equity, health literacy, health education, prevention and preventive services, homelessness, affordable housing, workforce development, unemployment, military issues, education, job training, education disparities, social isolation, chronic illness, oral health care, funding reduction to services such as the transportation cut, crime, violence, provider availability, smoking, tobacco use, poverty, obesity, diet, nutrition, exercise, and inactivity. So if you'd like to contact the Pierce County Health Department, and you're welcome to contact them if you want more information, I would suggest taking a really detailed look at your reading for the week, which is this actual report. And we will talk more about it this week and next week. It'll be your final week, 11, and we'll just cover mostly some big picture takeaways from both the Tacoma Pierce County health assessment as well as your class as a whole, and uh, connecting the dots between all the various different things that we've covered this quarter, which were definitely a huge medley of topics, but we'll summarize that and this whole process of a community health needs assessment um, later this week and next week. So just take a good detailed look at your reading and see you next time.